Hello everyone, I'm Dr. Adele, and in this brief video I'll be providing you with an overview of what a chalazion is and discussing the various treatment options available. Stay tuned to learn more about this eye condition and how it can be managed effectively. A chalazion is a small, usually painless bump that develops on the eyelid. It occurs when there is a blockage in one of the small oil glands known as meibomian glands located in the eyelid, which leads to the accumulation of oil and inflammation. Styes and chalazia are distinct eyelid conditions with various causes and characteristics. Styes result from bacterial infection in the eyelashes or eyelid glands, appearing as a red, painful, and pus-filled bumps. Chalazion, on the other hand, emerge due to blocked meibomian oil glands, presenting as painless, slow-growing lumps on the eyelid that usually develops farther back on the eyelid than a stye. Styes can be contagious if the infection spreads, whereas chalazia are non-contagious and non-infectious. Our tear film is consistent of 3 layers: mucin, water, and oil. Oil is the most important component as it lets tears spread over the eye and doesn't allow water evaporate quickly. The meibomian glands are responsible for producing the oil substance that helps lubricate the surface of the eye. This helps maintain the stability of the tear film and prevents dryness and discomfort. We have around 40 of these meibomian glands in the upper lid and 25 in the lower lids. They are positioned vertically along the eyelid margin, adjacent to the bases of the lashes. Meibom is secreted onto the surface of the eye every time you blink. This oil mixes with the watery component of the tears produced by other glands to create a balanced tear film. When meibomian glands are functioning properly, they produce a clear, lipid-rich secretion that is similar in consistency to olive oil. However, when these glands become blocked or dysfunctional, as in the case of a chalazion, the flow of meibom can be disrupted. Meibomian gland dysfunction refers to a common condition where the meibomian glands in the eyelid do not function properly. In this condition, either the quality or quantity of the produced oil is compromised. As a consequence, individuals may experience symptoms like dryness, irritation, redness, and a sensation of greediness in the eyes. When a blockage occurs in one of these glands, the natural flow of oil from the gland is hindered. As a result, the oil accumulates and leads to swelling and irritation of the surrounding tissue. Normally, oil flows into the tear film, but when it gets trapped in the tissue, our immune system identifies it as a foreign material. This triggers an immune response, causing inflammation and the subsequent swelling of the eyelid to fight this foreign body of the eyelid, which is our own oil that is trapped in the tissue. Chalazion typically starts as a red, tender area on the eyelid and can eventually develop in a painless lump that's usually not associated with an infection. While they can be uncomfortable due to the swelling and pressure, they are usually harmless and tend to resolve on their own within a few days to weeks. Warm compresses applied to the affected eyelid can help soften the oil and promote drainage. A warm compress is an effective home remedy for easing discomfort and aiding drainage in a chalazion. To perform a warm compress, use a clean cloth soaked in comfortably warm water and gently apply it over the closed eyelid with the chalazion over for 5 to 10 minutes. This warmth helps soften the blocked oil gland, facilitating drainage. Gently massaging the eyelid helps open the glands and allow trapped oil flow out of the gland. Repeat this process 2 to 3 times daily, avoiding excessive pressure on the chalazion. You can also use a warm compress mask that you heat according to the manufacturer's instruction. An optometrist or ophthalmologist might recommend antibiotic for a stye with an infection or prescribe steroid eye drops or ointment to address inflammation. In some cases, if the chalazion doesn't go away on its own or becomes bothersome, a doctor might recommend a steroid injection or surgical drainage to alleviate the blockage. If your chalazion is very swollen, or ophthalmologist may give you a steroid shot to reduce the swelling and control inflammation. If the stye or chalazion affects vision or does not go away with proper conservative and medical treatment, you may need to have it drained. This surgery is usually done in the doctor's office using local anesthesia. If a stye or chalazion keeps coming back after time, your ophthalmologist may biopsy it. This is where a tiny piece of tissue is removed and studied. This helps your ophthalmologist check to see if there is more serious eye problems. Do not squeeze or try to pop a stye or a chalazion. Doing so, you spread the infection into your eyelid. Also, do not wear eye makeup or contact lens while you have a stye or chalazion. This is Dr. Adele, and if you have any questions, drop them down in the comments.